Hello, everyone. I was waiting to see if more people joined. Right now, it looks like we have 51. I think I might give it a minute or so, and then we'll go ahead and get started. All right, everyone, we'll go ahead and get started. My name is Amanda Ferendorf. I'm with the Mo Health Net Education and Training Unit. I'll go ahead and get our PowerPoint started. Today, we're conducting a combined collaborative training with Mo Health Net and the Show Me Healthy Kids Managed Care Plan. And we're going to discuss several things that are going to be helpful for you. The objective of today's training is to cover Show Me Healthy Kids, a little bit of the background, the Show Me Healthy Kids goals and services, Mo Health Net resources, eligibility, third-party liability, and contact information. So I'm going to go over several of these things, and then we're going to move into the training portion with Show Me Healthy Kids. So first off, I'd like to give you an overview of what Show Me Healthy Kids is. So the Show Me Healthy Kids Managed Care Health Plan began on July 1st, which provides a coordinated medical and behavioral health care services for certain children and youth in Missouri. So Mo Health Net moved these eligible children to the health plan in July 1st of 22, to the Show Me Healthy Kids healthcare plan, which is going to be administered and managed by Home State Health. The health plan includes all the coverages that fee-for-service Mo Health Net straight Medicaid provides, and the same services that all of the managed care plans provide. Now, there are some additional services offered by that they are serving. So a little background on Show Me Healthy Kids and the mission. So this is a specialized managed care for youth who are in DSS custody, former foster children, and individuals receiving adoption and guardianship subsidies. So this initiative was to implement a specialty plan for these youth and establish a more integrated approach to meeting their physical and behavioral health care needs. So as you can see, there's a collaboration between Mo Health Net Children's Division, the Division of Behavioral Health, and the Division of Youth Services. So they all came together to start this specialized healthcare plan. Oops. All right, this is just showing you the services that Show Me Healthy Kids offers. Now, as you can tell, these are the same services the fee-for-service offers and the other managed care plans offer. That's just a list of them so you can look at them. Now we're just going to talk about some of Mo Health Net's resources. So Mo Health Net offers several resources and trainings to assist Mo Health Net providers. I'm going to go ahead and click on down here. I'm going to click down here, and then we'll actually go to the Mo Health Net provider page to look at some of these. So we'll talk about the Show Me Healthy Kids website, Mo Health Net Education and Resources, Mo Health Net Provider Hot Tips, and the bulletins. Now on this PowerPoint, you guys will get a copy of this, and there's hyperlinks to everything. So first, I think sometimes it's easier to look at things and actually walk through them rather than just looking at a PowerPoint slide, but the PowerPoint slides will serve as a good resource later on. All right, I'm going to click on the Mo Health Net provider page, and I'm just going to hit on some areas that I think would be important for you guys. And again, the PowerPoint slides are going to reference some of these and give you hyperlinks. Sometimes it's helpful to walk through these things. Over here on the right-hand side of the page, it says email updates, sign up for Mo Health Net News. What this is we ask our providers to sign up for this. This is like a distribution list that we use to reach out to all of our providers. So we use this to send you email blasts of bulletins, hot tips, rate changes, billing tips, all kinds of different things. So we encourage our providers to sign up for this to stay informed. Something else that is important for all providers, provider bulletins. I'll go ahead and click on this so you can look at that. So a provider bulletin would introduce new policy, changes to policy, clarification of policy, rate changes, something that's significantly important to the provider. And that's how we kind of introduce that and have it in writing on the website. We also have, so they keep like a year's worth of information on here and then they archive them. Now we do have a bulletin index, which is awesome. It's a great tool. You can go out here and search. I think there's one that's like Show Me Healthy Kids. There you go. So there's a few bulletins out here specific to your program. And you can also come out here and search too. Like there's one here, which I know that we're going to be covering later on, but I just want to show you, this is where this information is stored on the website. This one is really important for you guys to look at. And I know that the plan, Show Me Healthy Kids, will reference this as well as we have it in our PowerPoint today. So that's just an example of a bulletin that is helpful. I'm going to go ahead and go back to our provider page and I'm going to hit hot tips. This is another thing that we wanted to bring your attention to. Hot tips would be helpful information, like say we have some new training resources, things that are really important for you guys. And it's shorter than a bulletin. And there go all the way back to 2005. And we also have a hot tip index for this as well. Zoom in here. And so you can see if there's anything that is relevant to you. Now there's one that we'll bring attention to is this launch of the MoHealthNet division Show Me Healthy Kids website or webpage. This page is going to have lots of different information on it that will be really helpful to you. So here's just a link to it. This is an example of something that we'd send out in a hot tip. And just as a reminder, if you're not on mute, please mute your phones just so that it kind of eliminates some of that background noise. I appreciate it. All right, so the next thing I'd like to hit on is our resource guide. And like I said, it's going to be in the PowerPoint, so you don't have to remember all these places, but it's kind of helpful to look at. All right, so the provider resource guide, it'll discuss fee-for-service versus managed care, kind of give you some background on that. But one of the important parts is if you scroll down, you'll see all these helpful resources for providers, which would be really beneficial for you. The next thing on this resource, which is super important, is it discusses medical eligibility codes, ME codes. So once you're looking at a participant's eligibility, ME codes are super important. Everyone is assigned an ME code, which then basically directs them into whatever benefit program they have. So the individuals that you will be serving most likely would be in, yes, around here. There's specific codes for the program, but if you go in and look at eligibility, which I'll show you where that's at, there'll be a specific ME code attached to them. And then if you want to know how they're eligible, you can just go out here to this resource and search the code like I did, and it'll show you. Like this one's foster care, all of this. So this is really important to understand. Alrighty, so I'm going to go back over to the PowerPoint. All right, and like I mentioned, it's in this PowerPoint, so I'm going to move through this. This is MoHealthNet News. These are a couple of the important bulletins. And we included some links in here so you can go in and read them. And again, Show Me Healthy Kids, they're going to reference a lot of this information. There's another example of the hot tip that we looked at, the provider resource guide. The next thing here is the Show Me Healthy Kids website or webpage. This one is awesome. It has lots of information on it. So I'm going to go ahead and click on it so you can see it. This is what it looks like. And as you can see, it says, what is Show Me Healthy Kids? So it explains it. How does it work? What is covered? You know, the handbook, things that are really important. So I encourage you to go out there and look at that. All right, so let's discuss a couple things that are really important. So eligibility. I know that we're going to talk about eligibility quite a bit. And I want to kind of give you like a high overview of how you would be able to check that through EmoMed and why it's important. So once a provider determines that the participant may have or has MoHealthNet eligibility, it's the provider's responsibility to check it. So this must be done before visits. Now, this is written kind of broad to apply to all of our provider groups. We know that these individuals most likely have MoHealthNet, and that's why you're working with them, right? So this, I'm going to show you some things that are important, but just remember that when you're looking at this resource. So reasons to check eligibility, the name on the file, their eligibility on that data service, their ME code, which the ME code is really important. Commercial insurance, like you'll skip over Medicare. I'm sure that they won't have Medicare, but the commercial insurance is really important because we're going to discuss third-party liability and what that means. All right, how can you check eligibility? Eligibility can be checked on EmoMed as well as calling into provider communications. This is an example of what it looks like, our EmoMed eligibility screen. And once you go in, you'll be able to put that data service and the patient's DCN, and then it'll bring up the participant's information. So you just want to make sure it matches. And this is an example of what it'll show. So this one says active. It has a plan code. The plan code means ME code, and it says they're active on that date. And like I had mentioned earlier, you can click on the provider resource guide to figure out what those ME codes mean. It'll also give you a list of benefits that they're eligible for. All right, third-party liability. We just wanted to kind of give you an idea of how this works. So MoHealthNet is considered the last payer, the last resort when there's a possibility of a third-party resource for the payment for a participant's claims. So MoHealthNet is not obligated to pay for a participant's medical expenses until other resources have been considered. And this is referred to as TPL, and sometimes it's called other payer. These are just examples of third-party liability. The one that you're going to see most often would be this health insurance group or private, so like a commercial health insurance. What is the purpose of TPL? It's to offset the cost or recover costs to the state of Missouri. So MoHealthNet funds are used after other potential resources available to pay for the medical services have been exhausted. This ensures that state tax dollars are not used when another payer is responsible for all or a portion of the medical charges. So it is to the benefit to providers to bill the liable TPL before billing MoHealthNet, because many times the TPL will pay in excess of MoHealthNet's allowable. So this is just going to tell you if the patient has TPL. So when you check eligibility, the information on possible insurance coverage. So this information does not guarantee the insurance listed are the only resources available, nor does it guarantee the coverage is currently active. Sometimes a participant's eligibility will show third-party liability and they don't have it, and vice versa. Sometimes we don't know about it, but you know about it. So that's kind of important to know. This is an example of what the eligibility screen will look like when they have Show Me Healthy Kids. So you'll pull up the eligibility screen, you'll see the ME 13, well, it wouldn't be a 13, but you'd see their ME code. And then down below, you see where it says lock-in information, it says Show Me Healthy Kids. This is how you know that they have Show Me Healthy Kids, which means you would bill the Show Me Healthy Kids managed care plan, not MoHealthNet directly. Here's an example of Show Me Healthy Kids. Well, actually, one of our managed care plans and a commercial insurance. So this is potentially something you could see. So you'll see where it has the benefits, and then there's a lock-in here where it says MoHealthNet Managed Care. And this one says United Healthcare, but this is just showing you what it would look like. And then down here, there's Cigna, which is going to be a commercial insurance. This means you would bill Cigna prior to billing a managed care plan. So missing or incorrect TPL, whether the participant is enrolled in fee-for-service or a MoHealthNet managed healthcare plan, providers should report missing or incorrect TPL information. There's a hyperlink here to the form, the insurance resource report form, which we call the TPL-4 form. We ask our providers to complete that and email it into the TPL database unit. And they have a group that researches that and makes sure that the insurance is correct or it's not. They'll add a new one or remove it. And there's a phone number down here as well. So there's more information on TPL. If you have questions about it, you can contact Provider Communications through EmoMed. There's a provider communications management tool on EmoMed. You'll click on it and it's like sending an email, but it's through the portal, as well as calling the phone number and hitting option 1, the provider communications number. You can also contact MHD Education and Training, which is us. Here's our email and then the phone number. And then you can contact the third-party liability unit as well. All right, so here is Show Me Healthy Kids resources. This information is located on our provider page, the education and training page. But there are some hyperlinks here that will be very helpful. Contact information for Show Me Healthy Kids is right here, and there's some hyperlinks that will assist you in trying to reach the plan. The education and training unit, we offer training for providers on billing, well, fee-for-service billing. We educate providers, all providers, on resources and other, billing or eligibility things. I would like to bring you to our MoHealthNet education and training page. And this is where we have all of our trainings listed. You can sign up for them, as well as there's a lot of different resources out here. The ones that would be specific to you guys would be this home state Show Me Healthy Kids program, and there's several resources listed here. We also have some information in general resources that will go over the website like we did, but also really go deeper in looking at eligibility, which I think is really important for you guys. All right, so the next part of this will be the Show Me Healthy Kids managed care plan. They're going to discuss how to file claims in their portal training. So Stephanie and Jennifer will start that, and I believe Daniel will help them with sharing their screen. Thank you.
Amanda, thank you so much. My name is Stephanie Hubing. If anyone is not able to hear me, please let me know. So I am one of the provider engagement administrators at Home State Health. Jennifer Bennett is another one. And so we are more than happy to present to you today and answer your questions. We also have Shannon White, who's on the phone with us as well. So Shannon is our claims manager. So she's going to be able to answer any of those stump questions that you may have for us, that she can shed some light on us for us. So I am not able to quite see the presentation screen yet, but I will wait for that to appear. Daniel, just let me know if there's anything I need to do to help. Okay, I can share. That is fine as well. Okay, is everyone able to see my screen?
Yes.
Okay, thank you very much. I'm going to go ahead and go into presentation mode. Okay. So what we will be doing, I'm going to kick off the presentation first with going over the claim support. And then Jennifer, my colleague, is going to finish us up today doing exact portal training. So that, of course, is the best way to correspond with the health plan. It is a secure provider portal, so you're able to submit your claims and also do authorizations if necessary. So she'll take us into a deeper dive on portal training. So the first thing is, providers always wonder, how do I submit claims? And to take you back a little bit, and I think Amanda did a fantastic job. As of July 1 of 2022, Home State Health was awarded the contract for Show Me Healthy Kids. So during the that time into the end of 2022, there was actually a grace period for providers. So if you were not already contracted with Home State Health, you had that time to become contracted and thus credentialed, enrolled with Home State Health. So a lot of this is geared towards, what do I do while that process is still ongoing? And so hopefully, if you all have Show Me Healthy Kids that you're seeing right now, you're already contracted with a health plan. If not, we do have additional information how you can do that. But one thing that we do really recommend is if you're submitting your claims via a clearinghouse, and some of those are listed below, those are the preferred clearinghouses that we work with. It's really essential to let them know what payer ID that home state uses. So those are listed here in orange for you. For the medical payer ID, it's 68069. And if you're a behavior or health provider, the medical payer ID is 68068. And like I mentioned, at the end of this presentation, Jennifer is going to give really in-depth instructions on the provider portal. But we do ask that every group NPI is registered with MMAC. And if you're not already on there, this is the direct link for the portal. So just make sure you go there to register. At that time, you will be able to select a username and a password. Your username is your email address, and then you'll be able to select a password as well. We highly recommend that every provider enrolls in PaySpan. You may have utilized PaySpan with other payers that you've worked with in the past, but it guarantees that electronic fund transfer. So we want to make sure that you're getting paid as quickly and efficiently as needed. So this is the information that leads you directly to PaySpan's website. And literally it does take 5 to 10 minutes to complete that registration. They will give you a unique registration code if you have not signed on with them before, but it's a very easy process to complete. So say, for example, you had not contracted with Home State before and you were waiting on enrollment information or credentialing information. So we want to make sure that you're still able to submit claims during that time. So in the event that you're waiting on enrollment or you don't have access to the provider portal yet, that is an appropriate time to submit a claim via the 1500 form. So we have given a screenshot of what a 1500 form looks like. And so this can be obtained many different ways, but this is a paper form. And in this instance, you would need to submit a paper form if you were not fully up and running on the portal yet. So, as far as what information does a claim contain, we realize that a lot of people have never submitted a claim before, and that's perfectly fine. You may have submitted invoices to the state before. So, we want to make sure that you have the resources necessary to successfully submit claims and have them adjudicated and paid appropriately. So one thing that's really handy is at the bottom of this slide is the link to our website. So within this link, it gives our provider manual. And within the provider manual, it literally gives you step-by-step instructions on how to submit an appropriate claim. And at the top of this PowerPoint slide, it does show you for the claim header and the claim detail some of those fields that are needed. But on the next one, this is very important. This is that exact hyperlink to the provider manual. But it shows you as you go through the 1500 claim form which fields are required and which ones are conditional. So if it's marked R, that's a required field. If it's conditional, it's going to be marked C. Just make sure that you're filling out the ones that are required. And a special note, therapy and professional services are going to be billed on the 1500 claim form. Just a little bit, if you have never done a claim before, some of the medical terminology can be a little foreign to some of us. So we've tried to give some helpful definitions that you may run across when you're submitting a claim. But the first definition we've outlined for you is, what is a primary diagnosis? So without reading this for you, we just want to make sure that you know that is referring to the patient condition that demands the most provider resources during the patient's stay. And this is always used in healthcare. It's also known as the ICD-10 coding. This slide is very helpful because it gives some examples of what an ICD-10 actually looks like. So these are 3 to 7 character codes. The character 1 is alphabetic, character 2 is numeric, and characters 3 through 7 are a combination of both. And luckily, if you're not well versed in ICD-10 codes, here's a training link that's available for you. So you're able to go onto this. There's also a lot of other resources that are helpful, different coding books you can purchase, etc. And always as a note, if you haven't had the opportunity in the past to sign up for Missouri Health Net News, it's extremely important that you're receiving all communications that they are able to provide to you. So we've included the hyperlink to Missouri Health Net News and also a hyperlink to the provider bulletin specifically, which can help with coding and fee schedules. As far as HCPCS, so a lot of times we look at that acronym, what is an HCPCS code? And what this is, it's a 5-digit code that's used for our claim submission. And so there's actually 2 different levels of HCPCS codes that are based on the CPT codes, which are the procedure codes, if you will. So our level 1s are based on those CPT codes. They're used specifically for services and procedures. And then our level 2 is the healthcare services or procedures that are not performed by healthcare providers. So that's kind of an additional layer that you can include on your claim. And so those level 2 codes are the medical equipment, supplies, and ambulance services. And then we've also included our CMS website that you can go on to find commonly used level 2 HCPCS codes. So as far as a CPT code, this is commonly known as a procedure code. And a lot of times when we talk to providers, we do orientations, we do a lot of, really value added services that we want to help educate you on. But a lot of times, a lot of the same CPT codes are used commonly, every time you submit a claim. So we do encourage you, to go out to the AMA website, do a search on particular CPT codes to see what are the most common that are used. Also, the second bullet on this slide is a direct link to our prior auth tool. So if you go out to Home State's website and you click on this hyperlink, it will show you under Medicaid pre-auth tool. If you put in the CPT code, first of all, is it a covered benefit or not? Does Missouri Health Net reimburse for that service? And 2, does it require a pre-authorization or not? And so once Jennifer gives more entailed information on the provider portal, she will actually show you how to submit an authorization if it is required. So of course, as of July 1, we put on And I'm going to stop for just a second. I'm assuming all the chats that are coming through are being answered. Correct me if I'm wrong. Is someone kind of
Yes.
manning that chat? Okay, very
Yes,
good. If not, I will.
Shannon's got us. Shannon's got answering the claims questions, so we're good.
Very good, because if not, I was going to stop for a moment and answer those.
Thank you, Shannon.
Thank you very much. So as of July 1, of course, Home State Health, we started covering the PRTF services for those members. So providers need to bill a HCPCS code of H2013. And here pretty soon throughout the presentation, we will give specific examples of when these HCPCS codes are used and when they're appropriate to bill under that. So we do ask that all providers submit claims for other behavioral services, individual, family, and group psychotherapy directly to Home State Health, as opposed to submitting those claims to Missouri Health Net. So as promised, these are some of those slides that give more specific information. So if you're billing for a HCPCS code of H0019, this slide shows the appropriate modifier for facility type and treatment level. So as you can see on this grid, it has the specific level 2, 3, and 4, and then the appropriate modifier and treatment level is listed as well. And luckily, we do have some additional resources located at the bottom of this slide as well. So this is the PRTF bulletin, and then the Show Me Healthy Kids residential codes and rates bulletin that was finalized, and also the PRTF bulletin billing. So those are really helpful resources for you to look at too. So Show Me Healthy Kids was really a phased in approach. And that was very beneficial for all providers who were trying to really better understand what all was required. So as of October 1st of 2022, that was really the second phase of Show Me Healthy Kids. So at that point, we were able to bring on these additional residential providers. So Amanda spoke a lot about the medical eligibility codes. So those are listed here. So unless one of the patients that you are seeing falls into one of these medical eligibility codes, you would continue to submit those invoices directly to the state for payment. So these are other helpful HCPCS codes and the modifiers that are used, and also those HCPCS descriptions that are listed. This one's used for residential aftercare. And so for aftercare services, the HCPCS code of H2022 is used with the appropriate modifier as listed. So we talked a lot about, what happens when a claim is submitted, and when is it appropriate to submit those via paper versus the electronic version. And Jennifer is going to show us on the portal, of course, the electronic version, which is the preferred method. If we're submitting things via the portal, it's secured HIPAA. We know that nobody is either calling in or faxing information to us. And that definitely gets processed more quickly than sending in a paper claim. But in the instance you are having to submit a paper claim, once we receive a clean claim, it's processed within 30 to 45 days. And a clean claim is what everyone adheres to. It means that it's processed on the first pass. Everything is submitted correctly. There's no questions. There's no need to do a correction on that claim. And then please note that every claim needs to be filed within 180 days of that original date of service to be considered timely. If you ever have questions regarding a status of a claim, we've included our provider services phone number that's listed here for you. They are available from 8 o'clock till 5 o'clock, Monday through Friday. So they are more than willing to answer any types of questions that you have. And then any rejected claim will be followed up with a letter of notification. You will actually get that EOP to let you know why the claim is rejected. Now, as far as the electronic submission, which is, of course, the preferred method, once we receive the clean claim, that also processes within 30 to 45 days. Timely filing is the exact same. There's 180 days to submit that claim from the actual date of service. If it's a pending, paid, or denied status with a reason code, it appears on the provider portal, and Jennifer will actually show you examples of that in portal training. So you're able to filter to any claims that are paid, pending, or denied. And then rejected claims will not enter our pre-adjudication process. So we ask that you work directly with your clearinghouse to identify and resubmit those claims. However, if it's already in the portal, you are able to do a corrected claim or a claim reconsideration at that point. We definitely want to have as many clean claims submitted on the first pass as you do. So we want to alert you to the most commonly caused reasons why claims deny, and those are listed here for you. And the top reasons why claims deny are because an incorrect diagnosis code may have been used, that ICD-10 code was not used correctly. The incorrect claim was used. So perhaps a UB form was used as opposed to a CMS 1500. Always check eligibility. Amanda talked a lot about that, different resources that are available on the state's website. Is this member eligible for Medicaid as of this date? We'll also have that information on our provider portal as well. But EmoMed is definitely the best resource to check that. Also, we've listed our provider services phone number, which is the exact same number that was listed before, to make sure that that person is eligible. So we always encourage providers, if you're setting an appointment, make sure they're eligible at that time. And then when they come in for their appointment, check that again to make sure that they have not lost eligibility during that time frame. Also, make sure you're using the correct payer ID. So those numbers that I gave before that were in orange, make sure if you are submitting a claim that's behavioral, you're using that payer ID. If it's medical, you're using a different payer ID. Um, Reasons why it was denied. Perhaps the form was signed. We have to have a black or white, or I'm sorry, if it's denied if a black or white form was submitted, or if it was a handwritten form that was submitted. Of course, we want to provide the best support that we possibly can. So again, our provider services team is available Monday through Friday to answer any types of claims questions that you have. If you are submitting paper claims, these are the addresses that you would send those directly to. Everything is consolidated on one slide for you. Denote that the behavioral address is different from the medical address. Also, at the very bottom of the slide, there's a note. Please obtain a provider services reference number before escalating the issue. So whenever you speak to a provider services representative, they will tell you who they are, their name, and also give you a reference number. So perhaps your claims questions may constitute a project. So they will tell you what that project number is. Myself and Jennifer were both provider engagement administrators at the health plan. So we are assigned a specific territory. I happen to have the Northwest. Jennifer's directly below me on the western side of the state as well. And then we have other representatives that are available also. So if you do have an escalation, if it's something that someone cannot assist you with via provider services, you can escalate that to us and we will be happy to help you as well. This shows that escalation process. So, like I said, first line is always to call that provider services phone number first. You can also do a claim reconsideration. So this is the provider portal link to do that. You can do your claim reconsideration directly on there. You can also correct the claim as well. If you were not able to do it electronically, the previous slide gives you those mail-in addresses that you can do those reconsiderations for. And then luckily, Shannon's team also has this email box available. So if you have already called provider services, you have done that claim reconsideration, and you have more than 10 claims, we can provide you with what's called a claim escalation spreadsheet, and you can email our claims integrity team directly and let them know that you need help, you need assistance with these claims. Okay, and I just got an error message. So I've talked a little bit about a provider engagement administrator. And so like I said, Jennifer and I are both provider engagement administrators. So we provide education, we do orientation with all the different providers who are in our territory or region, if you will. So like I said, we want to make sure if you're a provider within our network that you are equipped with the right resources and tools that help you be successful as a provider. And then our helpful links are also made available for you on this slide. So all of this information will be sent to you at the conclusion of today's presentation, but please refer to this if you have any questions. The first one, of course, is the link directly to our website, which is a wealth of information. So I encourage you to go out there. If you're frustrated, there's something you cannot find, please don't hesitate to reach out to one of us and we will be happy to guide you through that. So I'm going to turn it over to Jennifer at this time. She's going to give you an overview of the provider portal. And Jennifer, if you'd like me to, I'd be happy to navigate through you, or if you'd like to do your own screen share, that's great too.
If you're fine, just going through with me, I'll just keep under you if that works.
Absolutely.
Perfect. All right. Well, hello, everyone. My name is Jennifer Bennett. I am, like Stephanie said, I am on the west region of the state of Missouri. So I take from the Kansas City and go down south almost to Joplin. So that's where I'm at. So this is for the provider portal. So like Steph said before, making sure that you do have that MAC number. You're going to need to have that because otherwise you're not going to be able to get into our portal. That has to be acquired first. So that's first and foremost. So for our provider portal, the portal allows you to check that eligibility, which you do need to be able to do because you cannot submit claims for ineligible members. So making sure that eligibility, you're going to be able to check that here. You can submit, correct, and check that claim status. And you can submit and view prior authorizations, and you can view those patient care gaps and much, much more through our portal. So the link is there so you can see it is free of charge. It is available 24 hours a day, 7 days a week. So you can't sleep at night, guess what? You can get into our portal at 2 a.m. if you feel the need. So you can get in and move around to see about those claims that are outstanding for you. Next slide for me, please, Steph. So the portal registration, so a tax ID, so your TIN, so if we refer to a TIN, which is your tax identification number, so a TIN can operate in more than one state. So the portal user, when you're coming into and you want to create that account, you can register for each health plan through the portal with the same username and password. So your username will be that email and password. If you've not created an account with us, under there where it says create new account, that's where you're going to click on that. It will take you to another page. You're going to register. You will need your tax ID number to be able to create that account, because it's tying to your facility. Next slide, please, Steph. So when you have the portal, there needs to be an account manager. So that portal account manager is that role assigned to the primary contact within your organization. The account manager is responsible for that day-to-day portal support of the users assigned to your 10. So some account managers task, that's approving access for any new users. So if you have, 7 therapists with you and you're the account manager, they can go in and create that account, and you as an account manager can then go in and approve their access. You do have the ability to go in and put that tiering of what they have access to. So it might just only be eligibility. You don't want them to have the access into the claims section of things. You just want to have the eligibility. There's different tiers that you're going to be able to see. You can assign those permissions, like I said. You can regularly adjust those permissions when the roles do change. And then the biggest one is terminating users when they no longer work at the practice. So if somebody is there and they had access to the portal, be sure to go in and terminate them, because otherwise they're going to continue to have access, because we at Home State are not aware that they're no longer with you if we've not received any rosters and they've not been termed from us. Okay, next slide. So this is when you get into the portal. Up at the top right, your name will be there. It's blurred out right now. So if you click to the little arrow to the side of it, it has your account details, the user management. It takes you to this screen. So under it, if you have questions like what does it mean to be an account manager? What does that user guide? You can select and click on the user guide. There's that arrow. It will pull up the user guide for you to be able to view. In this one, where everybody is blurred out, that's because these are all of the assigned users that were to the 10 that are showing for here. And you can see over in the red, it's going to say verify account. And then you're also going to be able to disable their account. So that's where that's going to be. And then if you decide who's going to be that account manager, their name will be there. And you'll also see where it says account manager access. That means that those individuals are your account managers. Next slide. So this is the portal account details. So like I said, your name's up at that very top right corner. So you can say Susie Joe. So you'll click and see account details. It's going to pull up this page. So it's going to give your name, your username. Your password is going to be starred. So you're hoping you remember your password, your telephone number, your fax number. And then it's going to have your 10s. So that's where you're going to be able to come in and you're going to be able to see, mark which ones are primary. So in this case, if you're just with us for Home State, for Medicaid or behavioral health or whatever tier line of business you're with us, it's going to be in here and you can mark them as primary. The other thing is you can click on where it says provider demographic update information. That's going to give you the instructions how to access that, to be able to see the 10s that you added to the portal account. There's also where you need to add a 10 to associate 10s to your portal account. You could put in your 10 name, your tax ID, and then add 10. If you ever need to update your account, sorry, Steph, if you need to ever update your account, there's the update account, there's the little pen, you'll be able to go back in there and update the account as needed. All right, next slide. Sorry, I got a little behind on myself. So we're making sure, so who is eligible for Show Me Healthy Kids? We're wanting to make sure we have this eligibility, because that's what you're going to need to have. You can't submit authorizations on ineligible members, or you're not going to be able to submit claims on ineligible. So let's make sure we have that eligibility. So Show Me Healthy Kids, like we said before, that's going to be those children in the care and custody of Missouri Department of Social Services, your children or youth in alternative care, the children receiving adoption or legal guardianship, and then that former foster care youth that were under the age of 26. So you still can see someone that's coming into you that's age of 24, because they could qualify under this umbrella. So it's going to be those that were in foster care on their 18th birthday and covered by Medicaid from another state, and who are not currently eligible for Medicaid coverage under another state's program. And then there's that former foster care youth that are under the age of 26 who are covered at their 18th birthday by MoHealthNet and who meet those other eligibility criteria. Then for home state health itself, those are going to be your women age 18 to 55 with no health insurance, children under age 19, and then those adults aged 19 to 64, and your seniors 65 and older, and then parents or caretakers of children and pregnant women and unborn child. So like we have gone before, so making sure you have those IME codes. These aren't accessible and necessarily in the portal. So this is where you need to be able to have this for your reference, to have this when you're going to be able to submit the claims through the portal. So making sure you do have this, save it, put it, bookmark it, however you want to have it. Make sure that you do have these IME codes. So you can see that we kind of set it out. So you have the 07, to the OF. So for your DSS Division of Family Services, your adoption subsidy, and then your DSS Division of Youth Services. If there's ever any time, you also can go to Emo Med to be able to get that too. Next slide. So checking eligibility, like I said, it needs to be done. So if a person contacts you and they want to set up an appointment with you, you need to check it at that time, make sure they have eligibility. Then at the time of the visit, make sure that you check to make sure that they still have eligibility. Health insurance and eligibility is fluid. So there could be a termination, whoever it might be. So making sure that you do have that eligibility. And just because you have a child that's in your services does not necessarily mean they are Show Me Healthy Kids. So making sure that you are checking that eligibility and they do fall under the Show Me Healthy Kids program. So when you are getting into the portal, you're going to check that eligibility. If the member does not pull up, verify your data that you entered is correct. So you can do it two ways. You can check under the member's ID and their date of birth, or you can check under the member's last name and date of birth. So also we're going to make sure, check for that other insurance, that where we'll go in the portal where it's that coordination of benefits, that COB, which we have that tab in the portal. So you'll be able to see that. And then as best practice, always, like I said, check that member's eligibility prior to and the day of that appointment. Next slide. Steph, did I lose you?
Yeah, no, it froze up for a moment. I'm going to hit escape for just a second. And see if it comes back. Okay. There you go.
All right, thank you. So when you log into the portal, this is where you're going to come into. This is the main screen. So we have it listed as 1, 2, 3. I like to say that there's like the first thing you're going to go to. This is plan driven. So making sure first and foremost, you're in the right plan type. So where it says plan type Medicaid, you want to make sure you're under the plan type that is correct. So if Ambetter would be pulling up and this is a Medicaid member, it will not show that member. So that's why first and foremost, make sure you're selecting the correct plan type. Then you can go to where it says 1, 2, 3. So entering that member's ID number or last name, their date of birth, and checking eligibility. That's one route. The second route is on the next slide. Hopefully we're not stuck.
Yeah, it's frozen. I really apologize. I'm going to escape and then try to come back. I might put this into just normal,
That's fine.
yeah, view. So
If not, I can try.
okay. If you all want to open up the floor for questions, maybe now would be a good time while I'm going to stop sharing my screen so I can bring this up.
If not, will it let me share?
Okay. Can you all see that?
I can see that.
Okay, very good.
So this is the second option to check eligibility. So when you're in the portal, your name is going to be up at the top. So where it says eligibility, where that number 1 is, let's first note, make sure you're checking that plan type. Like I said before, that plan type is going to be crucial. then click on eligibility. It will then pull up the screen where it's going to have this, and you're going to be able to put in that member's ID number or their last name, date of birth, and then check eligibility. It will then pull up the screen that is below it. So you're going to see that. So this is Aaron Doe, for instance. So we're seeing that this member is eligible. Okay, so they have that eligibility that is to them. You're also going to be able to see that date checked. So it would be the date that is being checked. You're also going to see the product. So in this case, this is showing that this is Medicaid long-term care non-dual. The care gaps, if there's care gaps that are out there, this person is obviously, it's showing they're non-compliant for their annual well visit. So this individual is not going to their doctor, in essence, is what this is meaning. So just an FYI for you as behavioral health specialists, if there's something medical that they're not seeing their doctor, something medical might be also going on, underneath and underlying. So just FYI to be able to look for that. And then you can also check over to that very far right. It says ER visit. So if eligibility is checked for an ER visit, you can click that ER visit. So if you go to number 5, where it says view details, it's going to take you to the next page. Steph, you frozen again? Did I lose you?
Jennifer, it shouldn't be. It should be on patient overview, slide 34.
Okay, I'm with you. Okay, it was a lag, sorry. So when you go to patient overview, this is where you're coming in. So this is going to say this patient is eligible. So this is showing that they're eligible as of January 24th, 2023. You can see that it says the view care team contact. And then at the very bottom where it says eligibility history, it's going to be able to show. So in this case, this is what it's saying is it's having you can see July 1st, 2022 ongoing. So there is no end date. It's saying that it is a home state health plan and it is a Show Me Healthy Kids. So you know that they're coming under us. Prior to that, they were with Home State Health Plan and they were in foster care. So that's where you'll be able to see what they are currently with. So in this instance, they are currently with Home State Health under our Show Me Healthy Kids. You can also see up where it says view care team contacts. That is crucial, especially for these Show Me Healthy Kids. So you're going to see who that care team, if they are having care plans, you're going to be able to see who that care team contact. If there's any issues or outreach needs to be had on both parts, you're going to be able to have it there. So next page for me, please. So the patient overview. So the patient overview as a whole. So this is going a little more in depth than the previous slide. So we're actually going to go down the side as it is where it says overview, cost sharing assessment. We're going to slide down this first. This is specifically related to this member. So you see that top bar that's up above where it says patients, authorizations, claims, message. That's an overview for all members. This is specific for this member. So let's just say this is Aaron Doe. We're just going to come up with for that. You're going to see that the patient is eligible as of today. So that date being of that November 19th, 2019. You're going to see the patient information, the PCP information. You're also going to see if there's, you're going to view their PCP history, their EPSDTs, in this instance, that care gap. So this person has a different care gap than that prior one. And then you're also, like I said, you're going to see that eligibility history. So in this case, for this example, this person had that SSI non-dual, and it was from December 1st, 2018 ongoing, and then what they had before. So with that said, at the very bottom where it says view clinical information, you click on that, it's going to take you to the next slide. So this is basically the patient overview. So this is giving you the 3 most recent ER visits. It does not matter where this is because it's coming from the claims that are submitted here to home state. So if they're going to hospital X and then Y and Z, you're going to be able to see that. You're going to have the facility/provider, the primary diagnosis that was under, and those dates. You're also going to have the 3 most recent inpatient admissions and those 3 most recent office visits. And then over to that top right, you're also going to have the 5 most occurring diagnoses. This is not all encompassing for all diagnoses, but these are the top 5 that are coming in, the most occurring that we are seeing. And then you'll also have that recent pharmacy activity. It will actually, if you go in depth into that, it will show the pharmacy, when it was filled, and those medications. So you can see, are they compliant with taking their medications? Are they not filling those? You're going to be able to see that in this under the recent pharmacy activity. All right, next slide. So like I said, we're going to just keep on going down the side. So this is to the assessments. So this is where if you need, there's a child welfare referral assessment. So this helps determine why a member is being referred to case management. They're already with case management because of those Show Me Healthy Kiddos. But if you're happening to see somebody that is not under the Show Me Healthy Kids and there was not a case management involvement, this is where you'll be able to complete that. And then the person-centered plan of service signature addendum. These are all here. These are where the assessments would be. Next slide. This is the health record. So this is actually kind of beneficial, especially, you know, like I said, behavioral health and medical can kind of go hand in hand with one another. So you can be able to see their visits. Like I said, this is coming from those claims that are submitted and to us. So you're going to be able to see the visits, their medications, immunizations, those labs, and their allergies. So you're going to be able to pull all of this up for this specific member. Like I said, for this specific member, you're able to see all this. It will give you those primary diagnosis, the date, the visit type itself, the claim type that it came in, was it medical, and then that facility provider. Next slide. So this is a care plan. This is a very important piece of aspect for behavioral health because this is the care plan that you're seeing. This does come from our clinical system. These care plans are set up with the case managers for the patient. Those Show Me Healthy Kids are tiered, so they go from that tier 1 to tier 4. You're going to be able to come in here. You're going to see who, in this instance, you're going to see who that caseworker is because it's up at that top right. You're going to be able to see the member's care plan to treat. So in this instance, that's that integrated care when it was opened. For instance, this member specifically is hospitalized, and you can see the goal. So this goal obviously was that member transition from the hospital to that home setting. So you're going to be able to see what is transpiring. We're by no means the case managers from home state taking the place of Division of Children's Services of their case managers. They also have that collaboration with our case managers. Next slide. So this is the authorization slide. So this one, like I said, there's 2 tiers. So you have your authorization that's coming here, but on that top bar, that was the authorization. So if you ever came into the portal and you're like, I want to look up authorizations, if you click that top and we really weren't thinking, the top bar, that's the overview for, it's the puddle of everybody that you've submitted those authorizations for. This one is specific to this member. So let me just make sure we have this clear. This is on the side. This is the specific to the member. So you can come in here and you're going to view a member's authorization. It will display the last 18 months. So this is going to be regardless of the submitting provider, you are going to see this. You also, under this one, can go ahead and create the authorization under this where it says the create authorization. This is where you're going to be able to come in to submit that authorization. On the back end, we will go over how do you look up to see if you need to have an authorization. That's on our pre-check tool that's out on our website. You put in, you answer 5 or 6 questions, put in a CPT code. It's going to say, yes, an authorization is required. No, an authorization is not required, or M for maybe you might need to. If it is required, it'll say log in here. That's when it's directing you to the portal because this is the preferred route for any authorizations for home state for Show Me Healthy Kids is through our portal. Next slide, please. The overview. So this is the referral. So if there is that need for that referral to come into us, it will come in. It'll have the source up at the top. So this is, you're going to be sending it to case management. The date, your name's going to be blurred. The name will be blurred out. Your contact information, and then why you're referring them over. If there's needing to be further inputs, if you haven't had any outreach. This is if there wasn't necessarily a case manager yet assigned. But those Show Me Healthy Kids do come, like I said, under that tiering of their care plans from that tier 1 to tier 4. Next slide. So this is the coordination of benefits. So this is where we were talking about that other insurance that could be out there. So when you come in here to the coordination of benefits, the COB, this in this instance is telling you, if you come into, let's say this is Erin Doe, you're going to be able to see that effective on 7/1/2016, the term date being 12/31/999, it's ongoing. If it's 999/4000, it's ongoing. It has not, we don't have an end date. It has not termed. You're going to see the policy number, the group number, and in this instance, you're going to see the carrier. So you know it's Blue Cross Blue Shield and that they have medical and hospital. being that these are Show Me Healthy Kids, this is technically under the Medicaid umbrella. This would be where you would be billing Blue Cross Blue Shield first, and then you would be billing to us as second to Show Me Healthy Kids. Blue Cross would always be primary. So if you're coming in here and to seeing a coordination of benefits and you're seeing another insurance and it's saying medical and hospital, you're going to be billing to them first as the primary and then to us as the secondary. Next tab, please. So this is for the claims. This is specifically, like I said, for this member. So you're going to be able to go back. You can view those claims. It does show you 1 month at a time. We can go back in more depth, but at this point in time, it's just that 1 month at a time of a clip. So you're going to be able to come in here and see the claims specifically for this member. So you can also in this section also go to the green tab where it says create a new claim. And this is where you could also submit this claim for this member. In this section also, you're able to see the claim number. So if you're submitting claims for Aaron Doe, you're coming in here, you're looking up for June 2020, it's going to pull up all the claims that you submitted to home state for Aaron Doe in the month of June. So it's going to give you the date of service range, the payment date, the date received, and then it's going to give you the billed and paid amount and then the status. So it's going to be either showing as paid, denied, or pending. That's where you're going to be able to see this. Next slide, please. The Document Resource Center. So if there's ever a point in time that we're requesting records, this is one route you're able to submit records to us. You can put this in here either for medical necessity or if it's for quality management, you can submit those records to us. Just make sure that that first page of the document, you're including the reason for the upload so we know why it's coming to us, the authorization number if it is applicable, and then be sure, this is the big thing, the record size. So we need to have, do not name it more than 50 characters, no special characters. That's another one. That is the biggest kick. Make sure you are making it less than 50 characters and then less than 25 megabytes in size. Next slide, please. This is the notes section. So this note section is in essence for you as a provider. So this is, you can create notes regarding the member. It doesn't flag to us here at Home State. These are like notes for you per se, that if you want to generate a note and you don't necessarily have an EMR and electronic medical records, if you don't have any of those and you're still writing on paper, you could put the notes in here, you know, for you as a reminder or whatever that needs to be. But this is the section for you to be able to have. All right, next section. So the patient list. Primary care providers can view and download a list of their assigned members. So they can, when they get into the portal, you're able to go in, filter, and then you can download your member list. It's going to display the member name, the member ID, your date of birth, preferred language, that eligibility status, the phone number, and alerts for that member. Next slide. So for the patients, so that patient list like I was just talking about, where it has that patient. So if you're coming in here as a PCP, you can come in and you're going to click on patients, and then you will click on download. It's going to be able, you can choose what you're downloading. If you just want to download your whole entire patient list with everything to it, you can, or you can filter and select specifically what you're looking for. Just if you're looking, if they just go to the emergency room, that type of thing, it's going to be able to see here, and you can see those care gaps also. Next slide. So this is the authorization. So like I said before, the one on that I reviewed before, that was specific for that member. This is all encompassing. So this is just you coming into the portal. You just want to do an authorization. You can click on that authorization up at the top. You're going to click that. You're going to put in the member's name and last name because now we need to tie it to somebody. You're going to put in their date of birth also. You're going to click find. The biggest thing to take away from this is, like I said in the beginning, you cannot create a web authorization on an ineligible member. That is the key to all of this. They must have that green thumb. If they do not have that green thumb, an authorization will not go through and be accepted. Next slide. Excuse me. So the authorization request. So you're going to click on that one, click that authorization. It's going to take you through the steps. Just make sure that when you are in creating that authorization, you're going through and you're making sure that you're filling the fields out that you need. Use the tab key to be able to maneuver through that authorization. In that authorization, it's going to go over the provider request. It's going to go over that service line. You're going to need to be answering the questions that are needed under that. And then you're going to click next, which will take you to, Stephanie, you're good, to the next slide. So that's where you're coming through, and you can see where it says provider request, your procedure, the service type. This is where you're looking at it, and it's going to say authorization required. You can then select complete now. That's where you're going to be coming in to create those. The residential prior authorizations, that prior authorization process, we did put the links down. So there's the residential prior auth that's below, and then that residential criteria, we did link those for you. So you would have those as reference points. Let's see. Okay, next slide. Accessing your authorizations. So when you come in here, like when you came to that main screen and you clicked authorizations, if you did not do create authorization, you could go up to the top, just create that authorization, and this will take you to the next slide. And like before, as I've always said, make sure, please, 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 that you have the right plan type. That is going to be the kick to everything. You need to make sure you're under the plan type, making sure that it's for Medicaid, not Ambetter, not whatever other lines of business. If it's specifically for those Show Me Healthy Kids, you need to make sure you're under the correct plan type. So if you come to the authorizations itself up at the very top, it'll pull up just the authorizations. You're not going to create an auth. You just want to see authorizations as an overview for all of the authorizations that you have done for your specific tax ID number. With that being said, you can go to which ones were processed, which ones are authorized. You're going to be able to see this. And you will also be able to see for the last 90 days, regardless of how they were submitted to us. So for Aaron Doe, you're going to be able to see those authorizations. Okay, next tab. This is going into the authorization detail. So we're skirting back over just specifically for that member. So if you're looking very specifically for those authorization details, like what exactly was that authorization, you're going to be able to see this. You're going to be able to see that service type. You're going to be able to see from date to date, the stay level. So you're going to be able to see this also, the location, if it was approved or denied, and then that decision date. Also on the next slide, it gets a little more in depth. So there's two that are hyperlinked. So you're going to be able to see their HCPCS code. Steph, next slide. Are you stuck? Okay. So you'll be able to see their hyperlinks. So you're going to be able to see exactly the diagnosis codes and also the procedure codes. And if you hover over your mouse over the items, you're going to be able to see the CPT, the rev code, and those HCPCS codes that are associated with that authorization. Next slide. So like I said, those authorizations, just make sure it cannot be submitted on an ineligible member. Generally, the authorizations load in the process in which they're queued. So that's within seconds of submission. Up to 5 separate documents can be submitted for those authorizations. So if you want to submit medical records onto that authorization, so when you're going through that authorization, you can choose to upload those records at time to be able to substantiate the reason for this authorization. So if it's a court order that you're to be seeing this member for X amount of visits, you can attach that document to that authorization. So that way we know why you're requesting this authorization to be accepted and approved. Always use the confirmation number to check the status of your request. And then the other big one is if an error is encountered when you're doing the authorization through our portal, it's not going to load. So therefore, it's not going to process. So you're going to need to redo that authorization. So at any point in time you're doing this off, you receive an error code, or even after you've clicked submit and it says error occurred, you're going to need to redo it. Do not assume that it did come through to us. Redo that authorization. Those authorizations also must be submitted through the portal. That did become effective for us. That went into effect January of 2021, so 2 years ago. Next slide. The claims. So the claims section displays claims related information, and it's divided into a series of tabs. So if you click on the claims up at the top, it's going to take you to the next page. Okay, well, we did this a little different. Okay, so this is the claim submission. So if you click on the claims itself, it's going to take you, you're going to go over to the red where it says create claim. You're going to enter the member's ID number or last name and their birth date, and then click find. You're going to be able to pull this up. So where you see this, you can see that there's individual. There's also the saved. You have the submitted, the batch. These are from claims that you've submitted to us if there's a case that you want to be able to check these. But in this instance, we want to create this claim. So if you're wanting to create that claim, you're entering that information, and then you're going to click find. So member's last name, ID, date of birth, click find. Next slide. So you're going to go through that claim. The claim process as it is. We ourselves cannot go through how to specifically tell you how to bill and how to create this claim. That's why we always will refer you to our provider manual. It is on our website. That manual, starting at about page 87, I believe, goes through. You're going to be able to see the fields, kind of what is needed in these fields for you to be able to complete it. That's where you're going to be able to go through. You're going to submit that claim. Once you submit the claim to us, it's going to give that confirmation ID. Please keep that confirmation ID for your records. This is where you're able to search for the claim on the submission tab, so you can see where that claim is. All right, next slide. So this is a claim submission, the upload electronic data interchange, that EDI. So this is for your batch loading. So when you get into the portal, you're going to, if you wish to do batch loading, you can do batch 837I or 837I and 837P. So those are where you're going to be able to put the batches. They have to be in that file format, making sure that you're making the naming mechanism no more than those 50 characters and no special characters in that. You'll select the file type that you have saved out on your desktop or wherever you're saving that. You'll attach that into this, where you choose to upload that file to us, and then you're going to click open and then click submit to be able to put that to us. Next slide. Sorry, I have a cough. Viewing claims. So like I said, when you come into claims, you don't want to create a claim. You just want to review the claim itself. The individual tab displays claims under the file, the tax ID number, and regardless of how, like I said, they were submitted. You can view up to 24 months of claims. The only thing is you can only view 1 month at a time. So just know that it's not going to give you all 24 months. So if you're looking specifically for June, you could just put in June 20, or let's say July 22. So you're going to put July 1st and do that month span and then click. You're going to have to do that for each month to be able to see that. If you wish and you want to filter, you do have that availability to search and filter for any additional options that you're wanting. But in this instance, this is showing individual claims to us. You can do, like I said, you can do over the saved, you can do those submitted. You're going to be able to come in here and to look at overall of what is the claims that are come into home state itself. Excuse me, sorry. The payment history, you're also able to do that. There is also on the far right, there's the claims audit tool. You can go and click on that. That is a tool that is also, it gives you a broader information also for your reference point for submitting those claims. If you wanted to see, sorry, Steph, go back one more. If you wanted to see a specific claim and you wanted to be able to review that, you can, under that, you can click on the claim number to view the claim details. So if you want to see that claim detail, you can click on that. It will pull up that claim in detail. You're going to be able also, you see that service date. You're going to be able to see that status of that claim. So what you billed us for, in this instance, they're all showing as what you billed for, and it's all showing as 0. That's because on that far right, it is showing as in pending status. But if they were approved, you can go back to that claim number and you're going to be able to open it up and see what's going on with that claim. Next one. So the benefits of the portal, like I said, it is available 24 hours a day, 7 days a week, so you can get in here. The cost savings, the portal is free to submit some claims and authorizations. We do know those clearinghouses are expensive. That is why we do have the portal option available for you, so you don't have to use those clearinghouses necessarily. This is better management of the patient's care, so you can see those care gaps. You're able to have that electronic format, so you can see it's a cleaner submission form. And then there's efficiency of that electronic authorizations and claim submissions. ability to view patient eligibility, and then ability to view both patients, providers, histories, and data, and ability to correct those claims if need be. So you're submitting the claims, you're able to also correct the claims within there. If we're requesting medical records, you can actually attach medical records to those claims and then resubmit to us also. That is the benefits of the portal. We do portal trainings individually. So if there's like we do in depth. So if there's some questions you have also, our team does do that. We do live screen sharings. We meet with you one-on-one, and we can do that live screen sharing. If there's obstacles that you're facing getting into the portal or manipulating through the portal that we might be able to do more in a one-on-one setting, we are always willing to do that. And our team is, like Stephanie said, spread through the state. So we are in different territories. So we can help any of you as need be. And that is any questions. I think maybe I'll switch it back over to you if you need.
I have a question.
Mhm.
I don't have a void button when you open the claim and you see copy claim, correct claim, or reconsider, and I don't have an option for voiding. And I had called in November and they said that I should have it whenever attached to my login, but it's never come about. And I had called again on about 10 days ago, and I still don't have any information yet. So is that supposed to have a button in that inside the claim there?
We don't go specifically, Christinda, we don't specifically go in depth into the claims when submitting in the portal because we ourselves, we don't, if we went it into the live environment, we would be submitting a claim. So we don't go in depth into the claim in the portal itself. That's where making sure going through each line, but I'm more than willing to get with you and see what you're seeing in the portal itself to see if this is something that you're missing. I don't necessarily know if we even, I don't know, Steph, do you know? I don't recollect having seen a void tab.
Really?
Yeah. So what I'm assuming is this is a situation where you've submitted the claim and there is an error, correct? And you want to void out that particular claim?
Well, what happens to me when I click on the like the drop down, and I might have clicked the wrong NPI for the tax ID I'm working with. So it's not like I could do a corrected claim. It means I need to do away with it because the wrong provider gets the check.
Okay, yeah, I think that's an instance we can look at it because
Yeah.
typically you would do a corrected claim, but if you're saying it's completely null and void, how would we eliminate that from the portal?
Correct.
So yeah,
I've done it through Availity. I can do it, but I'd rather do it on the Home State Health database since it would be quicker. I wouldn't have to go through it overnight. Easier to track because that's happened to me several times.
Christinda, will you put your contact information in the chat so that way we can reach out to you and we can look at that with you?
Okay, sure.
I appreciate it. Thank you. All right. Any other questions for us regarding I guess for me specifically for the portal? I see a lot of people asking claims questions of Shannon. So I see Shannon answering those as I think fast as she possibly can. Any other questions you might have for myself or Stephanie? I can see, is there any way to backdate authorizations?
Jennifer?
Yes, dear.
There's a question here. Will you guys be able to share the slide deck once we wrap the meeting up? We have a few folks in the chat asking about that.
We should be able to get the contact or the attendance for everyone, and we can send out the slide deck. I can also send out, we have an 80-page PDF that is for the portal. It goes in depth of how to submit the claims through the portal. And it goes in depth of how to attach those records to the claim if we're requesting medical records. It's in there. So we'll get the attendance and then we will be sure to send out the slide deck for this. And then also the 80-page PDF for the portal itself. We will get that for everyone.
And I guess as a question for Amanda, are you able to pull a attendee list from this particular webinar today to send to us? Okay, excellent.
Yes,
Daniel
Danielle
said
said
he
he
could.
could.
Okay,
Thank you.
thank you.
All right, I don't think I have any other questions coming through except for in the chat. So Amanda, I guess I will turn it back over to you.
I have a question.
Oh, yes.
If you have a claim that's been denied due to third-party liability, so that has been submitted through the home state health and has been denied, do I resubmit those to the insurance company on those CMS 1500 forms?
So you would, in essence, I don't know if Steph, you wanted me to answer or you answer. For those, you would go ahead and submit that to that first insurance, and then when you submit them to us, you can resubmit those through the portal. You would also attach that explanation of payment from from the first insurance, from wherever that might be, and then attach that into the portal. You could do that and resubmit that claim.
Okay, but the claim would be submitted to the insurance company on a CMS 1500 form.
Yes.
Yes. Okay. And then are there specific, are those someplace to get those forms specifically? Because I read something about the ink on them. You can't just use a printable copy. It has to be do I go to Amazon and order these 1500 forms or?
So yeah, so you could get them at Amazon. You could go anywhere, but you're going to need to make sure it has that software program attached to it, so you can upload that into your computer. Because otherwise, you're just going to get the 1500 forms because they're assuming you already have the software to be able to print, to be able to input that information. So if you're going to go the paper route, instead of the portal route, I highly recommend the portal route over the paper route. But if you're choosing the paper route, that's where you're going.
I guess that's where I'm getting lost. Okay, so the 1500 forms, you can't just handwrite on these and mail them to the insurance company.
No, you cannot. We do not accept handwritten forms.
Okay, so there's this place on the portal that has the 1500 form that you can fill in.
So the portal, when you're submitting the claim, is in essence the 1500 form in electronic format in our portal.
Okay.
It's built into the portal.
Yes.
Okay, so how would I resubmit that to the third party liability then? How does it get to them through the portal?
I could share my experience if that's helpful. This is Kelly LeDuc. I'm the program director at Gateways. Call the insurance company. If it's Blue Cross Blue Shield or whatever it is, you'll have to ask the parent or whoever is the insurer for that child. Usually it's a parent, to give you a copy of the card, and there'll be a customer service number you call. My experience has been they will accept a mailed CMS 1500, but each insurance company is different, so you'll have to ask. What she's saying is that through home state health billing, it's only through the portal. You're not, and it creates the 1500. If that makes sense.
I get it, but I just still don't understand how I get. Okay, so if I have a kid it's been denied, and I submitted the original claim through home state health, and it looks like say they have United Medical Resources or whatever, So how would I get that claim on 1500 to United Medical Resources? From the portal.
We don't have, our portal is only for Show Me Health, is only for Home State Health. It's not for Unite, it's only for us. So if you're submitting to another insurance company, you're going to be submitting on what they're requiring.
Okay.
Our portal specifically is only for us. This is where you're submitting only the claim to Home State Health for Show Me Healthy Kids.
Oh, okay. I get what you're saying now. So that what we're submitting through on is a 1500 form to you as you're like the insurance company. But okay, I get that. I thought you were saying it was creating one that I could submit to the insurance
No.
company,
No.
the third party
No.
insurance company.
Right.
Yeah,
Okay.
Home State Health is an insurance payer. So to Kelly's point,
Gotcha.
if that's United Healthcare, you need to follow their means of submission. And I will say some other payers do not accept paper claim forms. So
Mhm.
you might want to call their customer service phone number first just to make sure that that's allowed. If not, you may want to get on their portal, to be able to submit that claim, just whatever their preferred method or acceptable method is.
Okay.
UMR's website does not have that capability. What you need to do is get the paper forms from like Office Max, Office Depot, and I've used a company that it's real manageable to get your the software, and I can give you the name of that company if you want to look at that.
Sure, that'd be great.
Okay, let me get that. I was going to say something real quick. This is Amanda Farendorf with MoHealthNet. Like you guys are kind of curious about the other payer, third party. The information on the third party is on our portal, but I believe on Show Me Healthy Kids portal as well. But you can go on eligibility and see that they have this other payer, and the information is there to contact that other payer too. So just so you know that information's there, and you don't want to go ahead and submit to Show Me Healthy Kids, you don't want to submit to them until after you reach out to those other payers. And most of the time, other insurance companies do have some type of electronic portal because everyone's shying away from paper claims. So I just encourage you, like if you have a kid that has this insurance and you're going to be billing multiple times for them, right? So you could get that worked out with them and sign up for their portals, and that way it'll be easier. And then you're going to take that information and report it to Show Me Healthy Kids after you get that remittance advice or EOB. I just want to make sure you guys knew that resource where those, the policy information and stuff should all be on EmoMed.
So I had asked a question earlier about because I'm for residential billing is what I'm doing. So I typically was going to the Home State Health site first and putting in the claim, and then it would basically read out the date range I was trying to submit for and say, so then I would go back out and check the eligibility. And like it might say for this particular kid, say for October 1 through October 31st, they were covered for the 1st through the 17th. And then again from like the 19th to the 31st. Well, so I would have to submit 2 claims on Home State Health, but then I'd go out to EmoMed and I would submit 1 claim for the 18th because it would say it was covered there. So I'm essentially submitting 3 claims on one kid for 1 month.
Yeah.
But I'm not sure. I've only had a handful, maybe, well, just a couple actually that I've submitted on the EmoMed site that we've actually gotten paid on. Like we haven't received anything on them. So I'm not sure what's going on with that.
The claims integrity people, I'm with Gateways Group Home, have identified and sent us an email to the effect that it has been identified this is some kind of an error on the part of Home State Health.
Okay.
Our question is, when will it be fixed and when will we be paid? Because we're quickly using up our reserves And it's getting kind of scary. And our clinicians aren't being paid either because of a glitch in CMS and approval times. And we have started getting our rate increases, which is really nice, and we appreciate that. But we've not yet been paid for 5/6 of every 90791 we did going back to July 1st. And that's a lot of money. And bless you all. We appreciate your help. Many of us have seen everything you just presented numerous times. And while we appreciate your time, we're really needing to get answers to this question of when we can expect to be paid. Because if it's going to persist for another 6 months, we're going to have to close.
Hey, this is Shannon. Oh, I'm sorry. I was going to say, we do have quite a few projects that are in place due to system configuration issues. So if you can drop your email in the chat if you would like this listing, but I can put together for you a listing of known issues and any project numbers and try to get some better turnaround times for the items that we do already know about that's impacting all providers. Would that help?
Yes, anything you can do, we would consider helpful. We're also concerned about the fact I've had this presentation probably 4 or 5 times now since this all started about collaboration and networking, yet thousands of foster kids are going to be shut out of the Cox network, and we're in a rural community. And so there's nothing but Cox around us. And we have kids who've been working with the same physician for years. And so it's hard to wrap our heads around how this is collaboration when our kids and our agency are really being negatively affected by this issue with Cox. And I understand what's happened and how it happened and why it happened. But what is Home State Health going to do to help shore up this gap? I work with a family doing aftercare, and these kids have had the same doctor since they were born. They both suffer from anxiety and depression, severe post-traumatic stress. They've had the same doctor since they were born. And both of these kids have a hard time talking to anyone. And their mother, who just got them back out of our facility, out of foster care, can literally not find another doctor. So throw us some collaboration and networking because we're kind of lost and we're not sure what to do. And those, I think, I can't speak for every facility, but I think those are 2 of the major issues affecting us right now. That we're going to need help and answers because our reserves at Gateways are running out. And just personally, can you imagine if you only were getting a quarter of what your normal pay would be and how long you could persist? We've been doing this since July, and that's far too long.
This is Kelly. I appreciate you sharing that information, and I know Shannon's going to do her best to get some additional feedback and responses. And I know the team's been reaching out and getting information, and I appreciate everybody providing very specific details so that we can be able to help and assist you. I wanted to address your concerns around the Cox termination. We share some of the same concerns that you have as well. If there's very specific, like you shared a very specific member story, so our goal is not to have disruption in members' care, and for some of those very compelling reasons that you shared, it doesn't sound to me like these members would be a fit or have the ability to transfer care. So in these very specific situations, it is our desire that these members continue to receive the same exact care with the same exact doctor, same exact practitioner that they are receiving today. So it is not home state or Show Me Healthy Kids intent that they be moved away from their provider. So again, knowing who these kiddos are and how we can help facilitate the continued treatment plan is of utmost importance. And we are making calls to that effect. So we've been looking at children and adults who have a high utilization pattern within the Cox facilities and giving outreach calls and asking those questions. How can we help you not interrupt your care, making sure there is a plan of care in place. If beyond the continuity of care period, we need to extend additional single case agreements with Cox, that is what we're doing. Or if members can find a safe transition place, and then we are doing. Jordan, we've partnered very closely with Jordan Valley and Mercy Health Systems. They've stepped up and said, here's our capacity, here's what we can offer, and here's what we can do. So there are some very strong partnerships that we've been able to walk through. But again, there's very specific member concerns that you have. I would like to partner with you on those very, like I said, those very specific members so that we can get on those quickly and make sure that they don't have a fear of disrupting their care. We can just set up those authorizations and talk with the Cox providers and make sure there's a plan. And I'll make sure that the email to do that is in the chat as well.
Thank you for that. I appreciate it. We already work with Jordan Valley. They are so overwhelmed and overworked. I don't know how they can possibly take more patients. We already experience delays in getting kids' prescriptions called in a timely manner, and they're doing their best. The psychiatrist we work with there is wonderful, and we have a personal relationship with him. So I'm happy to work with you. I just dropped my email in the comments there. If someone could real quick just clarify for us the difference between billing code modifiers 25 and 59. Our question is how to appropriately bill if you're performing two services in one day, like group therapy and family therapy, or family and individual. I only do family and group at our facility, so being able to do those in the same day and get paid is important. I've been using billing code 25. That's what I used with Emo Med. I've been doing this since 2008. Never heard of billing code 59. I've been looking it up online and it's kind of confusing.
I put notes in earlier because I bill for that same scenario, and 59 is what Shannon had advised me, because 25 triggers requesting for medical records. And my place of service is 51, psychiatric hospital inpatient. And my therapists go, in to see them, but they're billed separately. So in that pay,
Well,
you have to put 59 on every line.
Well, I think the difference is probably the place of service. I'm working as a independent contractor in a residential treatment facility. And so I think the procedure code for me probably, or the modifier, is 25, but I don't know.
Shannon, would you be able to answer that question at all for them?
Yeah, I was trying to jump in there, but I made notes from the chat earlier to check on that, because we did exclude that edit or payment policy that requires medical records to be submitted. And I thought it was for both 59 and 25, but I do have that as a takeaway to get some clarification on how that exclusion was entered into the system.
I've been using modifier 25, for two procedure codes in one day, and I haven't had any requests for records or anything. It's all been paid smoothly. And one thing I have appreciated is that I can do family and group now on the same day. Used to with emo med, you could not do that. So that was helpful. We appreciate that.
Sure. So yeah, I'll have to get back with you on that. I need to go back to our configuration thing, but I did write that down as a takeaway.
And I'm sorry, what is the name of the lady that works in the psychiatric doing billing?
Are you talking about me?
Yes,
Okay.
you with the
Crescenda-
lovely Southern accent.
It's Crescenda Taylor,
Oh,
but
okay.
I go by
Oh, okay,
nickname
Yeah.
Cindy.
I see.
And so you say I have a Southern accent?
It sounds a bit like it, yes.
Well, I'm a Missouri native, but living in Tennessee, and I swear I'm not going to talk like these people.
Oh, no, it's lovely. It's beautiful.
Oh, thank you.
Are there any other questions for us at Home State that we might be able to answer while we have everyone together?
Can't think of anything else.
Amanda, I will turn this back over to you then.
Alrighty, thank you guys for joining us today. Does anybody have any questions for Mo Health Net right now? No? No?
Well, I'm still looking for a code to bill the maintenance for my DC4 kids.
Okay, Daniel, I know you're on here. Is that something that's referenced in that bulletin? Is that where that code would be? Do you know?
Oh, this is Erica, and I'm on. Maintenance
Okay, good.
payments are the responsibility of the Children's Division. So if I'm understanding what it is that you're asking, it's probably the maintenance piece. Is it room and board payment?
Well, the room and board, we've got that one, we've got that code. It's the maintenance that we are needing. Um, it was first my understanding that DMH was going to, or social services was going to continue to pay for the maintenance, but then I'm now being told that no, they're not, that I have to bill that through Home State Health. So I'm confused and I don't know what the code would be.
Can you talk a little bit about the service? We have a lot of folks on the call that could probably help you with that. When I hear the term maintenance, I think about room and board, but there may be a piece of that I'm missing. So could you talk a little bit about specifically what service you're asking about?
Well, we've got the daily rate that I bill for, which I've got the code for that, which is the what was it? Here it is. It's the 2022 HK, and no, here it is, the H0019 HKTG. But I'm still looking for a code which is for what we call the maintenance, and I'm not really sure what you guys are calling maintenance and what we are calling maintenance. So I'm a little unclear on that.
What's your facility?
It is Milano House for Borough Behavioral Health.
Huh. So you're billing the rehab portion using the modifiers, but you're trying to figure out the daily rate portion, right? The room and board portion, right? Not the rehab portion.
Right.
So you would bill that to us. You bill the Children's Division for that care. Is Don on the call? We can reach out to you
You
directly.
use faces just like
I
you
am.
used to.
Tammy, it's Dawn. Sorry, I was double muted and didn't know it. May I ask, not that it matters, but the maintenance comes, like, as Erica said, comes through Children's Division. Was there somebody in particular that led you to believe that it would be billed through Show Me Healthy Kids or Mo Health Net?
There was someone at our facility that I had a meeting with this morning that told me that we were going to have to start billing it through Home State Health. And let's see, I'm not really, I don't remember her name.
It's fine. You don't have to provide the name. How, if rehab is strictly the H0019, those codes, those modifiers are billed either to Show Me Healthy Kids or Mo Health Net. The maintenance portion is authorizations like Children's Division has always set up. You would have an authorization through our invoicing, like RTM4 or RTM3. It's the same process that is not changing. Your maintenance payments will come from Children's Division.
Okay, that was my question then. Okay.
One quick question before we end, though, Tammy, because I do want to know, are you participating in our monthly provider calls where we talk about some of that and we talk about processes around just the transition and how you'll bill for services? Are you participating in those calls?
No, I do not think I have been invited to those.
Okay. If you are, if you're someone that does the billing and payments for your facility, get with Mitra. She gets those invitations directly, so get with her, and she can make sure that you get the invitation to be able to participate in those calls, okay? Because we'll be talking about this for a while.
Okay.
All right. Does anybody else have any questions? It looks like there's something in the chat, but I don't know. I'm assuming somebody might be answering that question for them already in the background. Clarify the ME codes for residential behavioral health level 3.
Are
Would
you
it be?
looking for, oh, I'm sorry.
Oh, sorry, Shannon. I didn't mean to overstep. I just wanted to make sure. Is there a way that we could get a list of all the questions that have been put into the chat after this call to make sure that we have responded to each question? Okay, Daniel's going to do that. Thank you.
Awesome. Thank you, Daniel. All right. Does anybody have any questions for Mo Health Net? I was going to go ahead and conclude the webinar unless you guys, anybody else had any questions or feedback, anything that you need from us.
No, I just wanted to emphasize when you guys do look at that billing modifier for 2 services in one day, 25 versus 59, be sure to consider the place of service. Mine is 33, and I bet the other person's is different, and that may make a difference. So that's all. Thank you.
All right. Thank you guys for joining the collaborative training today. And hopefully we started some really good conversations here. Thank you. You guys have a great rest of the day.
Thank you.
Thank you.